The moderator for our last session is Dr. Jayne Weintraub. She's an alumni, distinguished professor and former dean at the University of North Carolina School of Dentistry, and adjunct professor in the UNC Gilling School of Global Public Health. She's a diplomat of the American Board of Dental Public Health and past president of the American Association of Public Health Dentistry. She's widely known for her expertise in oral epidemiology, dental public health, and clinical research, and she's a leader in research to understand and prevent oral health disparities. She's one of the co-authors of the commission paper for the workshop regarding the integration of oral health and primary care. Her current research cuts across the lifespan with a focus on prevention and relationships among oral health, healthcare, and systemic disease. Dr. Weintraub.
Alumni, distinguished professor and former dean at the University.
Dr. Weintraub.
Okay. Thank you very much, Dr. Rasa. First, I want to thank the National Academy and the Roundtable for bringing this important topic to the forefront, and to all the organizations who helped fund this event today. Integration of oral health and primary care is a health literacy issue. It's also a quality of life issue, it's a health issue, and it's a health equity issue. The theme for this panel is developing a research agenda. The need to expand the evidence base to drive policy was a recommendation in the commission paper and has been highlighted already several times today. As with other aspects of integration discussed, we need integration across the medical-dental divide with regard to workforce, finance, delivery, education, and research. The oral health profession can't do it alone, and as Anita Glickens said this morning, everyone needs to be involved in oral health. And as George Taylor indicated this morning, we need to build a sense of belonging for oral health to be part of health and health care for patients, providers, and policymakers. This is a health literacy issue. It is very gratifying to me personally to have so many people inside and outside of the oral health professions listening and learning together today. We need to work together to advance the ideas discussed. I really like Dean Schillinger's common risk factor approach to make our efforts a win-win-win. So we have a terrific expert panel from different backgrounds and perspectives. 3 are here and 1 will be joining us remotely. I will introduce them and then pose a question that each of them will answer from their own perspectives. I'll then pose several other questions that different panelists will answer, and then take questions from the roundtable and the audience. So I will introduce our panel first. Ira Lamster, sitting next to me, is our currently Dean Emeritus and Professor of Dental Medicine at Columbia University and Clinical Professor at the Stony Brook University School of Dental Medicine. Dr. Lamster served as Dean of the Columbia University College of Dental Medicine from 2001 to 2012, and Senior Vice President at Columbia University Medical Center from 2006 to 2012. From 2012 until 2017, he was in the Department of Health Policy and Management of the Columbia University Mailman School of Public Health. Dr. Lamster's research efforts have focused on diagnostic testing and risk assessment for periodontal disease, the interrelationship of periodontal disease and systemic disease, the oral health care needs of older adults, and the future of dental education and practice. His research helps provide the evidence base for why interprofessional education and practice that includes oral health is so important. Wendy Mouradian, who will be joining us remotely, and you can see her on the screen up on top there, is Professor Emeritus of Pediatric Dentistry and Strategic Advisor for Regional Initiatives of Dental Education, or RIDE expansion. She was the founding director of the RIDE program and the immediate past Associate Dean for Regional and Academic Affairs. A pediatrician, she was one of the first to champion the inclusion of oral health in the medical school curriculum. I want to acknowledge all those efforts that Wendy made starting several decades ago. In the past, Dr. Mouradian has served as Special Advisor on Oral Health to the Health Services and Resources Administration, HRSA, on the integration of oral health in primary care, and was Project Co-Director of the Surgeon General's Workshop and Conference on Children's Oral Health for the National Institute of Dental and Craniofacial Research at NIH. Her research areas have included oral health workforce issues, ethics, and policy issues in the provision of oral health care to children, quality of life for children with craniofacial conditions, and interprofessional collaboration. Hugh Silk is currently the medical director of a wellness and primary care center in Leominster, Massachusetts, as part of Community Health Link, providing creative and meaningful care to patients with mental health issues. He's a professor in the Department of Family Medicine and Community Health, and also teaches at the Harvard School of Dental Medicine, and does public health work in oral health access and training healthcare providers to address oral health as part of overall health. He's a recipient of the 2016 American Association of Public Health Dentistry Public Service Award. He's been a true champion and advocate for oral health and its integration into primary care for many years. He's currently working on a 5-year HRSA grant to evaluate and implement oral health in medical dental schools and primary care residency programs across the country. Cathy Yarborough is the lead public policy analyst for the Health Policy Institute of the American Dental Association. She's responsible for researching and analyzing policy changes that impact dentistry, oral health, and the overall healthcare landscape. Ms. Yarborough focuses on Medicaid, Medicare, dental access, and patient-centered outcomes. She obtained her MPP from the University of Chicago and a bachelor's degree in sociology from the University of Illinois and Urbana-Champaign. So we have a very distinguished panel, and I'm going to start by posing to all of them this question. When you think of health literacy and oral health integration, in your area of expertise, what do you think is the most important area to address? So we'll start with Dr. Silk at the end there.